Hello, my name is Joni Baker, and today I'm going to talk to you about dementia. I'll begin with an introduction to dementia, followed by the case study. Then I will go over the human response, including the physiologic, pathophysiologic, experiential, and behavioral components of this disease. Then we will go over nursing therapies, followed by gender and social determinants of health considerations, followed by SMART goal achievements, and a conclusion. As an introduction to dementias, it is also known as neurocognitive disorder with 62 possible medical causes, including Alzheimer's, Parkinson's, and Lewy body dementias, as well as medication-induced dementias. This condition is characterized by progressively decreasing brain function and is diagnosed by cognitive evaluation, imaging, and sometimes confirmed on autopsy. In this case study, we are discussing an 85-year-old retired widow living alone with a long history of bipolar 1, hyperlipidemia, essential hypertension, osteoporosis, and anemia. Her recent history includes an emergency department visit after becoming lost while running errands in her neighborhood. Findings were weight loss, dehydration, and a steady, unassisted gait, and acute mania with wide lithium variation within the previous 3 months. The physiologic response in normal aging is a retention of language, comprehension, and general knowledge, with expected declines in the speed of learning, short-term memory, and the ability to multitask. The ability to make decisions is retained. And assessment and surveillance for cognitive status should be undertaken by nurses using resources like the mini mental state exam regularly and throughout care of this population and the older generation. Initial cause of neuron loss varies by disease and may include hypertension, ischemia, neuroinflammation, Lewy bodies, and more as part of the physiological response. In hypertension, especially systolic hypertension in this case, the small arteries of the brain are affected, resulting in the loss of the autoregulation of blood flow, causing a disturbance in the blood-brain barrier, and white matter demyelinization. And that white matter, or the cortex, these changes may not be reversible, and so prevention of progression is paramount in dementia. The experiential response, what people are feeling from the inside, is the impaired memory, the challenges with complex thought, the inability to complete their routines, difficulties with self-care activities, trouble with decision-making, and a loss of independence as they become more dependent on others to support their daily lives. The behavioral response may be seen in a variance in medication adherence, as well as mood disturbances, deficits in meeting their basic needs, impaired problem solving, agitation, and sundowning. Some of these things may be seen when there's a lack of understanding or when there are communication challenges. Nursing interventions in this case were to set up this patient's pills weekly, and then the family provided phone calls daily to make sure that she had taken her medications. There was a caregiver in place who saw her more frequently. She had minimal scheduling, no more than 3 activities a week, to provide more free time and less stress. DPOA had been identified during advanced care planning, and after this event, she agreed to stop driving as part of her safety plan. They did also install closed circuit television monitoring to allow her to live alone for a longer duration before moving her in with one of the family members. Nursing interventions for this population are also listed here to the right. Gender and social determinants of health considerations. Women are more likely to be diagnosed in their lifetime than men, possibly due to prolonged survival or sociocultural vulnerability of women. And there is a lack of access to healthcare, low education level, early life adversity, high stress, discrimination, and low economic status that are all associated with increased rates for dementias. Some SMART goals that were used for this patient were to maintain therapeutic lithium levels within 6 weeks by using a medication organizer, and the patient will improve food intake and hydration status within 2 weeks using family support through phone calls, visits, and outings. The caregiver, family, and patient made a grocery list within a week to keep items on hand to decrease the likelihood that the patient would want to drive herself to get things that she was missing. And this is the care map that I created that you have seen in bits and pieces. And some of the key takeaways are assessing patients for cognition using the mini cognitive assessment regularly is a major part of care for identifying and preventing the progression of dementia. Utilize known supports, provide clear, unhurried communication, and support self-care. Thank you.